myself, our goal is to add value out there as kinder liaisons and to help them move these people along. But so we're going to go through some of the clinical marketing messaging. We're going to do some exercises at your table. We'll do some picket fences. We'll rotate a little bit. Then we're going to do a couple more picket fences, some case studies, and then one midday for you, okay? So at this point, we're going to finish with your book. So page 36. Turn to page 36.
36
I'm sorry, 46. How bad is that? I think I need cheaters now. Like, I looked at that, really, and didn't see it. You tell me 50? That would be 50 in July. I can't believe that. Yeah, 18, that'll be 50. Oh, my kids are making fun of that. 47ers were a 45th birthday. So I apologize for that. So page 46. Again, we're here to talk about and just introduce you guys to our clinical marketing message, our value-added messaging, so to speak. Again, it's all about the theme today is gathering all those points and creating a message around it so we can present to our case managers and have those conversations to, again, best suit the patient, move the patient forward in the admission process, get them converted and in the door. So as we go, we advertise, well, I use the word advertise, which really market. As we go out and market in our facilities, everybody has heard of the elevator pitch, the 30-second commercial. You guys all heard of that before. So that's basically what page 46 is all about. So as we talk about qualifiers, to be skilled for Medicare, a patient must, and it goes on to talk about they require require daily skilled nursing 7 days a week, or rehab 5 days a week. Does anybody here know if their facilities have rehab on the weekends? Okay, yeah, that's another good point. Find out, if you don't know, find out if you have rehab on the weekends. 7 days a week is a huge selling point. Or if a patient is admitted on a Friday, and you can say to them, look, you're going to be evaluated for rehab tomorrow, because what are the two things you get asked most out in the field about a patient? Okay, yeah. Besides a private room, therapy, yes. When am I going to start therapy? And what private room, and when can I eat? What's the food like? That's another one everybody gets asked. So and you guys heard of RNACs before? The nurses who actually do the qualifiers for the coding for the patients, for the RUG scores that you read about in your iBooks. The RNACs, they used to be called RNACs, yeah. But basically nurses review the chart and they actually find all the information that we send in, they dig through it to find little snippets that can qualify a patient to have a higher RUG score. So overall, for a patient to be qualified in a skilled facility, they need skilled nursing care 7 days a week. So a nurse has to be doing something for them. It requires a skill 7 days a week. Rehab 5 days a week. Have a 3-day qualifying inpatient hospital stay within 30 days of beginning a benefit period. So that's a lot to take in. But does everybody understand that? Okay, you're good with that. Connie, are you okay with that? That means if you go see a patient in the hospital at your STAC, and we talked about this, Connie and I talked about this, she sees a lot of 72-hour observation patients. So she can't go by the admission date on that patient. She has to clarify whether that patient was truly admitted or are they here under observation. My sister just was in the hospital a week ago, and she was considered an observation. She was there 24 hours. Some of these places have 48-hour observations, now 72-hour observations.
I also like two of those in a lot too. They don't, because they're saying that it should like Medicare or whatever. They don't qualify at a hospital level, so they can't admit them. So I'm seeing that a lot lately too.
Right, because we do follow Medicare rules. So this is something that you two, Connie and Helen, bringing up. Pay close attention. Be very careful. Make sure that that patient has actually been there 3 midnights as an inpatient stay, okay? Because I know there's nobody here that wants to bring a patient in that doesn't qualify because of that 3 days. When I was a liaison, I almost did. I was in Indianapolis and I was a good guy. Until the admission coordinator said, wait, she hasn't been there 3 days, 3 midnights. Because the demographics weren't on accurate. But they figured it out when they looked up for Medicare. Okay, so require daily skilled services for a condition that was treated during the qualified hospital stay. So overall, if a patient has COPD and they had some CHF and they're actually being treated with some IV Lasix here and there or PO Lasix and they're real weak, you just want to make sure that or if they're getting IV antibiotics, that documentation, they're going to do what's called a look back. see what that treatment plan was at the STAC. They'll follow it through at the subacute facility, but they'll actually be able to charge for that. So they'll actually formulate, just like the physicians, they'll formulate their treatment plan around what the patient was being treated for on the STAC. As a practical matter, the daily skilled services required by the patient can be provided only in a SNF. Okay, so what if it can be managed at home? What other areas can a patient go? If it's not home care, hospice, or is it practical? You remember the patient we just saw in the case study for the grid that had the chest tube restraints? Would it be practical to even consider that patient for a SNF? No, not even a TCC probably. Unless, of course, in Connie's instance, they'll review the chest tube patient first. Okay. All right, so moving forward, we're going to start building marketing messages based on, for you guys, this is your elevator pitch. So what we'll do is we'll have somebody read the marketing message. Connie, how about you? Read the marketing message for us, beginning with Kindred can be appropriate.
Kindred can be appropriate for patients that require daily skilled nursing care or rehabilitation services in a safely controlled environment. Our interdisciplinary team will ensure that the care of the patient are met for their
The typo for an optimal chance of recovery. That's what I was supposed to say. You have to pay for the rest of the sentence.
Yes, it's up to you to guess. Okay, so what we noticed in here, just, so what we're going to have you do at your seats, we're going to have you actually formulate your elevator pitch or your 30-second commercial. You don't want it to be too wordy because you want to be able to memorize this. And actually, Dr. Muldoon, who's on the LTAC side, he has a really good one, but it's very long as far as any kind of availability for you to use this at the SNF level. But just keep in mind, Kindred, you want to, as Lawrence was mentioning earlier, create the value. State what your intention is during your, when you start off with your elevator pitch. What are you there to when you're in an elevator or you're catching somebody, even though they may not be a driver, you're still trying to get your point across as quickly as you can so that you can gain their attention and start that conversation. So while you're at your seats, you can start with, again, state your intention. Kindred can be appropriate for patients that require daily skilled nursing care. Add features and benefits. One of the features to skilled facilities that you have rehab services. It's safe. It's a controlled environment. Are you guys getting the picture? So you feel comfortable, go ahead and create one of your elevator pitches and do it the way so that you can keep it. Stick with it, something you want to refer to later when you get home. We'll give you a few